Hello and good morning, everyone. I am Dr. Sindhura Vaddamani, consultant obstetrician, KIMS Cuddles, Secunderabad. So today I am here on the occasion of World Breastfeeding Week, which is celebrated every year from August 1st to August 7th. The purpose of this week is to raise awareness about a common practice, yet a practice where there are several barriers for which we need to address them and raise some awareness to overcome these barriers, and that is breastfeeding. So breastfeeding is beneficial both for the mother and the baby, we all know that. So why do we need to raise awareness? It is something that comes very naturally, not only to humans but also to the entire animal kingdom. So why do we need to raise awareness? Because there are several barriers which prevent mothers from freely and happily breastfeed. So, India uh, stands at 55% when it comes to the mothers that give exclusive breastfeeding. It is only 55%. So, we are far away from the magic number that is 100. So, to reach this number, we need to overcome several barriers. First of all, let us know what are the benefits of breastfeeding for both the mother and the baby. For the baby, breastfeeding enhances immunity, prevents babies from ear infections, respiratory infections, from diarrhea, and on the long term, prevents obesity and chronic diseases such as diabetes and hypertension. For the mother and the baby, it develops an emotional bond between both of them, which is essential for good neurological development of the baby. And for the mother, it helps in faster recovery, which women face on the socio-economic front, on the cultural front, on the educational front. So, when it comes to socio-economic barriers, like women face a lot of stigma at workplace or in public places. A very common scene such as a get together or a party. Or for example, from my personal experience, I was stuck in my car in a traffic jam with my baby, where I was very anxious to feed. My baby was crying. Luckily, I had excellent support from my family members, and I could feed my baby in the car in a traffic jam. So, such support is very much essential, and support begins from the family. So, I would say this, what we need to tell people is you support the mother to support the baby. So, the mothers need to be supported first. So, at workplace, the environment should be conducive to breastfeeding. Mothers return back from maternity leave and they haven't yet weaned their babies. It's too early after 6 months, and they still need to feed their babies. So they need a place where they can feed their baby, or they need to pump their breast milk. So a private room. It is not difficult to arrange a private room at all workplaces for women who need to breastfeed. This would bring about a lot of confidence in mothers and would relieve their frustration. Support from husband, family members to bring the baby to the workplace so that the mother can feed. So all these practices actually help the women breastfeed without interruption. Coming to cultural stigma, uh, there are so many stigmas in people, starting right from the family. So I think before we move on to the community, the support should begin from the family. There is a concept of support groups. The more women talk about breastfeeding and their concerns, or their successes, the more normal it becomes. So we need to normalize this breastfeeding by talking about it. Talking increases awareness. From the healthcare point of view, if any women has any concern or questions regarding breastfeeding, they must immediately approach the healthcare provider. So a lot of times we hear that uh, there is inconsistent advice from healthcare providers. Like one doctor would say something else, the other doctor would say something else. So women are confused. This also leads to frustration. So advice should be consistent. And for those of you who don't know, there are people called as lactation consultants who are certified exclusively in supporting women who breastfeed. So we do have a lactation consultant, a certified professional lactation consultant with us here at King's Cuddles, and she provides wonderful support to all our mothers here. You can approach your obstetrician, your primary doctor who delivered you, and along with that, you can approach your lactation consultant. So coming to support groups, so talking to women who have gone through uh, this journey, this breastfeeding journey, uh, having support groups in your community, uh, and then going on social media or talking about your stories. All these things actually helps raise awareness. So I also want to bring in this point that maternity leave is a right for all women. They need to avail it from their workplaces. The Maternity Benefit Act of 1961, which has been passed by the government of India, it has been recently revised. So for the first child and the second child, women are have the right to avail 6 months paid maternity leave, and from the third child onwards, it is 3 months paid maternity leave. So this maternity leave is very helpful and crucial for you to go through your journey of postpartum recovery as well as breastfeeding and bonding with your baby. So those who are in this lower socioeconomic status who cannot have access, those who are in the rural areas who cannot have access to quality healthcare or healthcare providers, you can always go on social media. Social media is available for everyone. Um, we are here to help you in all possible ways. Um, we are here to give you advice in your local language also. Those who cannot comprehend or understand English. So advice will be provided to you in your comfortable language. So become aware, empower yourself, and the theme for this year is closing the gap. So it is all about overcoming all these barriers, the socio-economic, the cultural, the educational barriers. And once we work together, so the mothers, the families, the healthcare, the community, everybody needs to work together to overcome these barriers, and only then we can achieve a 100% breastfeeding rate in our country. So yesterday I had put up a breastfeeding quiz. I had circulated on the social media, and I got a very good response for this quiz. So the magic number is 111. So I got 111 responses for this quiz. I would just like to read out the questions and how people responded to it. So among the responders, I had almost half of them were healthcare providers, doctors, nurses, allied staff, and the rest 50% were non-medical personnel. They were expecting mothers, husbands, relatives of expecting mothers or delivered mothers, and delivered mothers themselves. So the questions were like very simple, but a lot of them gave very good feedback. So, when is the World Breastfeeding Week celebrated? So, as I said, it is August 1st to 7th, that is going on right now. So, most of them answered it correctly, 90% right answers. So, those of you who don't know, I think now you know. Second question is, in the first few days after birth, the breast produces special kind of milk called. So answer is colostrum. So this colostrum is a very valuable milk that is secreted, and it should be available to all neonates without fail. So 94% answered it correctly. The third question is, how long must you exclusively breastfeed your baby after birth? So WHO recommends 6 months exclusive breastfeeding. Exclusive means giving only breast milk and nothing else. So after 6 months, usually the complementary feeding starts. So 75% of the people answered this correctly. That is 6 months. Breastfed babies have a decreased risk of. So decreased risk of, answer is all of the above. Options were ear and respiratory infection, obesity, and diarrhea. So breastfed babies have a decreased risk of all these three things. 90% answered this correctly. Mothers who breastfeed have a lower risk of, so breast and ovarian cancer, osteoporosis, diabetes, all of the above. Again here, 50% answered it correctly. So mothers who breastfeed have a lower risk of osteoporosis also, in addition to breast and ovarian cancer and diabetes. Which breastfeeding position is best for mom and baby? I had a similar query from multiple people that backache and sore nipples are the most common concern of women. So there are some breastfeeding positions recommended, like the cradle hold, the cross cradle hold, the side lying position. So as long as the baby and you are comfortable, any position is fine, provided the latching is good. So there is no particular recommended position. It's just that your posture and your comfort is important. We have a very good physiotherapy team here to help you with the positioning and the postnatal postures and exercises. So they can help you with this. What is a good latch? So latching means the connection of the baby to the mother's breast. So latch should be pain free. The baby's lips should be turned out. The baby's chest and stomach are resting against the mother's body, and the baby takes in both the nipple and the areola to suckle. So the most common problem here is only the nipple. Women think that the baby needs to suck only on the nipple. So this is where sore nipples arise. The thing is that the baby should take in some part of the areola also surrounding the nipple, and the baby's lips should be turned out. So this kind of latch is usually pain free. So answer is all of the above. Okay. Once there is a good latch, usually breastfeeding is pain free. There will be maybe mild discomfort, but it is usually pain free. What is the theme for the World Breastfeeding Week 2024? So the theme is closing the gap. Gap is the barriers which prevent mothers from freely breastfeeding. So as I said, only 55% of the women in India um, currently are known to breastfeed. Maybe the percentage is much lower because it is not it is not representing the entire country, and we all know that most of our country is the rural population. So we need to work harder to close the gap and increase the percentage of breastfeeding. Breastfed babies have higher IQ at school. So 80% people answer this correctly. The answer is yes. Breastfed babies have higher IQ at school and better academic performance at school. What do mothers need in order to breastfeed their babies happily? This is the next question. So answer is all of the above. I've provided 5 options: support from family, support from community, allowing breastfeeding in public with no judgment, adequate counseling and support from healthcare providers, and awareness about breastfeeding. So here we've discussed about all these things. So all these things should go hand in hand. Okay, any one barrier will prevent this breastfeeding from happening. So I got some good responses also. So, people have said it's a very informative quiz. People said that it was nice to answer this quiz, and everyone should get adequate knowledge about breastfeeding and its importance. So that is why we are celebrating this week, and we must all support and encourage mothers and support for breastfeeding. So somebody said this is absolutely true. Good initiative. So a quiz like this, it is engaging for people. Uh, it, it's easy to answer the questions. It takes hardly a few minutes, and people are getting the required information. Valuable questionnaire. Appreciate your awareness spreading. So these are the responses I got for this. And there was a question from somebody. So nipple pain or sore nipples is a common problem mothers experience during breastfeeding. So as I said, good latching is important. So usually, especially first-time mothers who are doing it for the first time. So breastfeeding is actually a skill. It's a skill that needs to be mastered. So it is a new thing both for the new mother and the baby. So both of them need to master it together, and tremendous support from the caregivers. That is the immediate family is crucial in achieving this and mastering this skill. So here we end the discussion about breastfeeding. If there are any questions on the live, I'd like to answer. So there are some questions. Doctor, what is mastitis? What are the signs of mastitis and how is it treated? So what happens is after the baby is born, the lactation axis. So milk comes out through the nipples, but there is a higher control for milk production, and that higher control is in the brain. So when the baby cries or when the baby is suckling on the nipples, it is a stimulant for the mother to produce milk. So what happens is as the baby gets used to drinking milk and as the mother produces milk, a few days after birth, the milk production is significantly higher than what the baby is taking in. So there's a lot of milk in breast leading to engorgement. So the breasts are filled with milk, and if they are not emptied on time, the milk stays there and it gets inflamed. So this inflammation is called as mastitis. Okay. Uh, Signs of mastitis are fever, pain in the breast, redness. So the skin over the breast, part of the skin becomes puckered, like crumpled, like. So then what we need to do is we need to treat it how we treat fever. So we need to give paracetamol and we need to apply hot fomentation on the breast, and we need to empty the breast. Okay, emptying the breast completely alleviates all the signs of mastitis, and if it is even more severe, then you need to consult your obstetrician first, and they will probably prescribe you antibiotics. So, if mastitis is ignored and not treated on time, it can lead to something called as a breast abscess, where there is pus collected in the, so the milk gets infected and there is pus, and we need to go for a further procedure called as incision and drainage, where we need to surgically remove the pus. Um, I'm hoping that no mother gets this kind of situation because it is very painful and very traumatic for the mother. So, at the earliest signs of mastitis, we need to treat it. The best way is to prevent it from happening itself. So, whenever you feel your breasts are getting heavy or engorged, you need to empty your breast as soon as possible. If your baby is not drinking it, you can express the milk and store it. How to maintain breastfeeding while returning to work and what are the challenges and solutions? So, like I said, um, now all the workplaces pretty much have a private space or room called a breastfeeding room. We also have it here at Cuddles. Um, so the mother can feed the baby in the room. The family member can bring the baby for feeding, and once the feeding is completed, the mother can return to work. Um, Workplace staff must be supportive to allow the mother to breastfeed as long as she's doing it. Otherwise, she can also Alternately, she can pump the milk through a breast pump and send it back home for the baby to feed. So this way she can maintain her breastfeeding and she need not wean her baby much earlier. When is it necessary to supplement with formula? How can we introduce formula without impacted breastfeeding? So, first of all, why do you want to introduce formula? That is the question here. You need to consult your pediatrician before starting formula. There are some conditions where a woman should not breastfeed, or if she breastfeeds, it is harmful for the baby. So, if a mother is HIV positive, so in these conditions, sometimes your doctor may say that if you breastfeed, then it is you're going to transmit the HIV to your baby. So, in this case, it is better not to breastfeed. So, this is just one example I'm giving. So, what are the reasons why formula needs to be given to the baby? Depending on that, formula will be started. But this is all only after you consult your pediatrician. What birth control methods are safe while breastfeeding? So, breastfeeding itself will provide some method of birth control, but it is not 100%. So, many people know that while breastfeeding, so people think that while breastfeeding I cannot get pregnant. No, that is not 100% true. Uh, Breastfeeding will prevent you from ovulating, that is, the egg releasing from the ovary of the woman. But sometimes she can, sometimes she may ovulate and she may get pregnant. So, this lactational amenorrhea method is not 100% safe. So, during breastfeeding, your doctor may advise you on additional contraception. So, usually we don't recommend the combined hormonal pills. The estrogen containing pills should not be taken because they affect the amount or quality of breast milk. So, there are other methods like barrier method or what you call as condoms. So, condoms are safe in pregnancy. You can go for a copper T insertion. Copper T is inserted inside the uterus. This is a medical procedure which is done in the hospital setting by your obstetrician, or you can go for another type of pills which contain only progesterone without estrogen. So, for different methods, whichever method is suitable to you, your obstetrician may recommend it and you can follow that method. How can I ensure I have enough milk for my baby? What are the signs of sufficient milk supply? How can I increase milk supply? So, um, you you don't have to ensure that you uh, have enough milk supply. So, if your baby is feeding and your baby is not fussy, not crying, your baby is having enough wet diapers, and your baby is gaining weight at the pediatrician's visit. So, you will go for vaccination, right, to your pediatrician, and during the vaccination visit, your baby's weight will be checked. So, during that visit, your pediatrician will tell you how your baby is doing. So, that itself is an evidence that your breast milk is sufficient for your baby. Okay. Uh, there are some foods that can increase blood supply, such as soya, garlic. These are age-old things which our mothers, grandmothers told us. So those do increase milk supply. So we do provide them in the postnatal diet. Our nutritionist gives you a nutrition chart when you're getting discharged from the hospital. So these foods are mentioned in the nutrition chart. Is it normal to experience sore nipples? How can I relieve the pain? So, like already said, sore nipples are not a normal thing, but they are a common thing. It is common because of lack of knowledge about good latching. So, good latching will prevent sore nipples. Also, to prevent dryness of the nipples or cracked nipples, uh, we do recommend uh, ointment which is available. So it is basically to soothe the nipples. There are ointments which are non-toxic to the baby, so you can put on the ointment and feed the baby before and after the feed. So ultimately, it is good latching that will prevent sore nipples. How often should I be waking my baby to feed? So recommended is actually 2 hourly feeding, but um, what we say is on-demand feeding. On-demand means whenever the baby wants. So initially, you will take time to understand the patterns of your baby. So how frequently your baby is feeding, how long your baby is feeding, how quickly your baby is feeding. So once you understand the pattern of your baby, each baby is different. Once you understand the pattern, then you can do it accordingly. What if my baby is refusing to breastfeed? So what is meant by refusing to breastfeed? So is your baby crying too much? Is your baby fussy? So I think in this case you need to visit your pediatrician. There may be several conditions where your baby is not able to breastfeed, like a tongue tie or anything like that. So you need to visit your pediatrician to address your concerns, and you also need to visit the lactation consultant if there are any concerns from your side. Doctor, can I continue breastfeeding if I get pregnant again? Yes, definitely you can continue breastfeeding. Actually, um, we do recommend continuation of breastfeeding even if you get pregnant. And wean off at your own pace. Okay, suddenly you need not discontinue. Doctor, what is the minimum months we should breastfeed? So, like I said, the World Health Organization, it recommends 6 months of exclusive breastfeeding and 2 years of continuation. So, after 6 months, you will start complementary feeding or solid food. Breast milk will be an addition. So, solid food plus breast milk, you will continue to breastfeed. So, it is recommended that you can feed up to 2 years. Okay. Is it okay to drink coffee while breastfeeding? Is there any diet need to maintain, and how long? So, anything, so when it comes to diet, we say anything in moderation is okay. So, anything in excess is not okay. So, is there any diet to maintain? We have a team of good nutritionists here who will help you with the diet chart for your postnatal period. You can consult them. Doctor, recently I've seen there are nipple creams available. Can I use nipple cream? Yes, definitely. Like I've already said in the other question, nipple creams can be used. Most of them are non-toxic to the baby. Some of them say you need to wipe off the cream before feeding the baby, but you have to read the instructions on the product. So I think that's all. The questions are done. So thank you for this session. I hope that I have raised enough awareness about breastfeeding in both medical and non-medical personnel. Um, it was good to see the response on the quiz. Uh, Hope to do more of these sessions. Thank you.